Hi, my name's Joanne Smith. I'm a physiotherapist and work in the COVID rehab programme for staff in Bradford, Airedale and Craven within the Primary Care Wellbeing Service of Bradford District Care Trust. This is part of a short series of talks on how to support your mind and body in the recovery and management of long COVID. If you have at any point any concerns about your symptoms, please seek medical advice. This video is focused on shortness of breath. Following COVID, many people find they are left with symptoms such as shortness of breath, which can impact on their lives. These are a few tips that can help you manage shortness of breath and tension, feelings of tension in your muscles whilst breathing. The first point is that whilst breathing is essential for life, it requires energy, and it's important to make breathing as efficient as we can. Breathing in a way that allows the most oxygen and the least effort and fatigue. The points that follow will allow you to do this. One of the ways breathing can be more efficient is to be in a position that allows for good expansion of the lungs. The lungs are like balloons, and oxygen needs to get right to the bottom of the lung for good oxygenation to occur. This can be affected by how we sit, stand or lay. Sitting slumped or standing stooped does not allow for good expansion. So think about the position you are in. Make sure you're in a comfortable position, sitting or laying down, and allowing your lungs to expand fully. When we are sitting, take a few minutes to think about your position and your breathing. Are you feeling relaxed? Are your shoulders relaxed? Or do you have stiffness and tightness? What's your breathing rate? Are you breathing fast and shallow, or are you breathing deep and relaxed? See if you can think about relaxing your shoulders and your neck whilst you are breathing, and ensure that you are comfortable. This relaxation will allow more efficiency of breathing. So relax your shoulders, notice your breath, and allow the shoulders and neck to relax. Check whether you're breathing through your mouth or your nose. Mouth breathing isn't very efficient. Shortly, we're going to do a breathing exercise, which will allow you to think about these things in practice and can help you manage your breathing through the future. So the following exercise is designed to allow you to relax, take some deep breaths, and feel comfortable with your breathing. Initially, we're going to place one hand on the chest and one hand on the tummy. And I just want you to sit relaxed as you can and think about where you're breathing to. If you're breathing well, you want to be breathing so your hand on your tummy is moving more than the hand on your chest. If you are a mouth breather, use this point where you're feeling relaxed to think about breathing in through your nose and out through your mouth. I want you to try and picture a rectangle, and we're going to breathe in on the short sides of the rectangle and out on the long sides. So if you can breathe in for a count of 4 and out for 6. So breathe in for 4, in, 2, 3, 4, out, 2, 3, 4, 5, 6. If you do this in a comfortable position, this will allow your muscles to relax further and allow you to get some nice deep breaths in. And lastly, the final point I want to make is that it's important that we keep moving around, whether indoors, outdoors. Walking and changing position allows us to naturally take deeper breaths. So the more we can move around, the more you will naturally take a deeper breath. Now, you may be limited with what you can do, but walking around the house and just generally keeping active as you're able to will allow those lungs to open up more and help you manage your shortness of breath. Thank you for listening.